Hey everyone, welcome back to my channel. Today I'm going to share the story of how we found out I was pregnant. It is a wild story, one that a lot of specifically women will cry to after they hear it because they just can't believe what a miracle it is. But also I've been told multiple times that I should write a book after hearing this. So I hope you enjoy it. It's still very surreal that this has happened to us. So if you haven't watched my previous videos on my cancer diagnosis and all the treatment I had gone through, that plays a really big part in why this story is so crazy. So I'll do a little recap just so there's a full understanding. So when I was first diagnosed with breast cancer, in all of the treatment options, I decided to start chemotherapy first. And when I told my breast surgeon that, I wanted to try to shrink the tumors so that when I had the double mastectomy, they could save some of my skin. The very, very first thing she said to me was, you're 29 years old, you're a young patient. If you want to have kids, you have to freeze your eggs. I would have to wait 2 months to start treatment, and I was almost stage 3, so I chose not to do that. So from day 1 of treatment, it was pretty much kids were out of the picture, not an option unless you did this. So, but then also chemo can have a really negative effect on your reproductive system as well. So that was the first really big part of that. But also within my treatment, I also am on endocrine therapy, which because my hormone receptor status is HER2 positive, my estrogen and progesterone feed the type of cancer that I have. So medically, they have to stop that from happening so that my recurrence risk is not super high. So with that happening for over 3 years now, I've been medically induced into menopause basically. So that treatment is a form of chemotherapy. Every month I go to Roswell Park. It's just a nurse visit, and it's an implant. Well, there's 2 parts. I get an implant injected into my stomach. I'll post a picture of what that looks like because it's horrendous. It's not like a liquid injection. The implant looks like a piece of rice. Like that's about the size of it. And the syringe that they use when they put it into, it's a huge needle, number one. It's like if you were to use like a gauged piercing, like a 16 gauge, that's pretty much what it looks like to have that pellet go through. So, but when they put it in, it clicks like a pen, which it's just super gross. So that's the first part of it. But then also I have to take a pill every day, an anastrozole, to work in conjunction with that to basically shut my reproductive system down. Internally, those parts of me are like a 65-year-old woman. I am in full-blown menopause, hot flashes, no menstrual cycle, like the pits. So that's also a very big part of this. So that I have been in it for over 3 years. So when I go to the doctor, especially the OB, they're like, they always ask, when was your last menstrual cycle? And I'm like, I don't know, 3 years ago. And they always look at me like with a tilted head because it's just not a normal thing for, someone in their early 30s to say. So, but that's a really big part of this. So in August of last year, I changed jobs, and in doing that, after I started at the new place, I did not have health insurance for a month. And when I had gone to Roswell in September to get my injection, like I always do, I went in, everything was fine. And about a month later, I got a bill for almost $2,000 for this injection. So I decided, I was kind of mad, but I didn't do Cobra, which is like the other health insurance to cover you over, because it was wicked expensive. I'm like, it's 1 month, it should be fine. But, now I have this bill, which whatever. So I decided they have made a ton of money off of me already from everything that I had gone through over almost 4 years. So it was a super slow time. I just started a new job. I wasn't about to send them a check for $2,000. So I'm like, I'll pay a couple $100 a month. And then if they need it all at once, then I'm sure they'll let me know. So Now rolls around November. It's late November, and I'm sitting down to pay bills on my day off, and I pull that bill out, and I realize I can't remember the last time I had my injection. So now the important part of this is I've been having this done for over 3 years, okay? Not once have I ever had to make an appointment. My oncologist he also does urology as well. So on Friday, my day off, I go to urology, and that's where I either see the nurse, and then every 3 months I have blood work, and then I see my oncologist, and then I get my injection also. So for 3 years, I go in, I have my shot, or I see the doctor. They, a week later, mail me an itinerary with my next appointment date. It's always on a Friday. It's typically always in the morning, but I've never, ever had to make an appointment myself. So now I realize I can't remember when I had my last injection. And I'm thinking, like, it definitely wasn't this month because it's typically always like mid-month. And I definitely didn't do it this month. So now I'm thinking, okay, well, maybe I did it September and October, and then I couldn't remember. So I called the urology clinic, and, you know, I kind of felt bad for the woman on the phone who picked up, because I also wasn't sure how I was going to react based off of what their response was. So I had asked her, I said, here's my medical ID number. Can you just tell me when my last Zoladex injection was? And she looks it up, and she gives me a date mid-September. So I said, okay, well, let me get this straight. So I come in, I have this injection, billing finds out I don't have insurance. Even though I've been there every month, sometimes multiple times in a month, for almost 4 years, you just don't make my next appointment or the next one. No one calls, no one asks, did you change insurance? Did you change jobs? Did you go on your husband's? Nothing. Now I'm pissed. And this poor woman is so apologetic. I'm like, I understand it's a big place, but how does someone not make a phone call? I am there all the time. How does my oncologist not see that I have not had 2 injections? I'm supposedly such a high-risk patient. How does this happen? So I tell the woman, look, it's the end of November. I said, I have to come in December 7th. I'm having an endoscopy and colonoscopy at Roswell. Just make the appointment for that day. Whenever I'm done with that, I'll come in and just get the injection. Unless Dr. Levine or my oncologist wants to see me, then I will, whatever he has to, whatever he wants to do. So she said, I'll put you in for 1:15 for December 7th. Just come down when you're done, and we'll just, tell a nurse to come see you. I'll let them know the situation. I'm like, that's fine, thank you. So now I tell Eric, and he's not happy, to say the least. He doesn't react well to things that he can't control with me as far as this whole thing goes. So, he's really upset now too. So fast forward to December 6th. I start prepping for this endoscopy and colonoscopy the next day. Now, I have to have this done every other year because I'm in a high-risk clinic for colon cancer, because I have 2 mutated genes that increase my risk of having that, but also my grandfather passed away from it. So it's just preventative. It's an easy enough test. The first time I had it done, they actually removed 3 polyps, which certainly wasn't expecting that. So it's not pleasant, but it's just, again, what you have to do. So I go in, I go into work in the morning, and I have to take, and every place is different, like people I've talked to on the prep for it. So I had to take 2 laxatives at noon, 2 more laxatives at 2 o'clock, and then 2 more at 4 o'clock. Now I took the first 2 at work, and I only work like 5 miles from home. So I'm like, I should be able to get home relatively quick if things start moving a little faster than I anticipate. So I take the first 2, and then like 1:30, my stomach's not feeling great. So go home, take the next 2. At 4 o'clock, take the last two. No, I had to take 8. The 2 weren't until the next morning, so I take the 6. Now at 4 o'clock, and I had started this prep the night before, you get a jug. I'm not even kidding. It's like a 1.5 feet, 2 feet tall, this big. It's like 2 gallons of this lemonade powder. It's just disgusting. And you fill it with water and you keep it cold because it's actually better that way. And then you have to drink the first half that night before you go to bed. Then you had to wake up, take 2 more laxatives in the morning, then drink the second half. Now, my appointment was like 7:30, 8 o'clock in the morning. I think it was like 7:30. It was pretty early. So if your procedure was scheduled before noon, you had to finish all of that liquid before 4 o'clock in the morning. So now I go to bed at 11 o'clock at night. Not feeling great from all of that. Obviously spent most of the night in the restroom. Couldn't really get anything done. Super annoying. I wake up at 2 to start drinking this stuff again. And I wake up, I really don't feel well. I feel dehydrated, but I'm already drinking so much liquid, and then it's just coming right out. And like, I couldn't even fathom drinking more water. And I was drinking it out of this, like Under Armour, like plastic cup with a straw in it, because it's much easier to drink it faster if I can drink it through a straw and like not smell as much of it. So I was doing that. So I go and at 2 o'clock in the morning, I fill this thing up again, and I would take like 10 huge swigs at a time just to try to choke it down as fast as I could. So I do that, and immediately my mouth starts watering, and I'm like, oh my God, I'm gonna get sick. And I did. I threw all of it up. So now I'm sitting there on the couch. All 3 dogs are sitting there with me like, what are you doing? Why are we up? Why are we not getting our breakfast? And I'm like trying to encourage myself, like, you have to drink this. Like, you have to, otherwise you're going to do all of this prep. They're not going to be able to do the procedure because whatever. So I feel like garbage. I'm trying to drink it, still feeling super nauseous. I drink again. I wind up throwing that up as well. So now it's like 3:30 in the morning. I had given myself like an hour rest, and I'm like, maybe I'll just feel better. And it's not like I can eat crackers or anything to like make myself feel better. So finally, I drank a couple more sips. It's all I could get down before 4. And I'm like, I didn't finish all of it, but I have to go back to bed. So I do wake up at 6 o'clock in the morning to get ready to go. And I don't like get ready. I don't put a ton of makeup on, just showered and whatever. So we get to Roswell by like 7:30 in the morning. And, you know, the process is the same every time I go in for surgery or a procedure. They check me in. I sit down. One of the CNAs come to get me. They take me back. They do vitals. And then they have me change, put an IV in, so on and so forth. So before I had gotten changed, I had asked the CNA, I said, can I just go to the restroom real quick before you put the IV in, and then I gotta like cart that thing around, because my stomach is still not okay. Not as far as throwing up, but like things are still happening in not a good sense. So she's like, yeah, I'm going to need a urine sample. And I'm like, how is that going to happen? Like, there's just pure liquid coming out of my ass. I can't try to pee in a cup. Like, I'm so stressed out about this. Like, and it's so gross. So I'm sorry. But it's actually what's going through my head. I'm like, how am I going to pee in this little, and I mean, they're little cups. So I successfully take care of that. And now my stomach, again, still, it just feels like I have to go. So I go sit down in the bed. I get all changed. I open up the curtain, and the nurse walks by, and she grabs my chart and has this little piece of paper. And now the whole unit is totally open. There's just curtains in between all the different beds. People recovering on one side, people waiting to go in on the other. anesthesiologists everywhere, nurses everywhere, like it's all open. She walks maybe 20 feet away from me, and I'm watching her because there's nothing else to do. And she points to whatever she has on this little piece of paper, and the anesthesiologist says, "Do not start her IV." So now I'm like, huh? So she walks over, and she passes me, and then she comes back, puts the binder down on my little table, and she said, "We'll be back in a little bit." And I'm like, "Well, what's the problem?" And she goes, "Oh, there's no problem." I'm like, "I just heard you. Like, why are you putting my IV in?" She's like, "Oh, well, honey, the doctor will come talk to you in a little bit." And I'm like, wrong answer. What is wrong? Like, I heard you. What is happening? Like, I didn't even know what to say to her. I'm like, I understand there's things you can and cannot, tell patients based off of whatever your title is, but like, hello, I just heard you. It's not like I didn't see the whole thing just transpire in front of me. So she's like, "Oh, it's nothing. He'll come over and talk to you in a little bit." And I look at her and I asked her, now I already know this, right? I already know it's a pregnancy test. Before every surgery or procedure I have, they make me do this. And I always laugh and I tell them, it's not possible. I'm medically shut down. Not a chance. Like, it cannot happen. I would be like the Virgin Mary. Can't happen. So I look at her and I ask her, I say, "Was that a pregnancy test?" And she shakes her head. And I just start sobbing. And I'm like, and? Like, I already knew, but like, I needed her to tell me, like, yes, it was positive. And she did. And I'm like, it's not possible. There's no way I can be pregnant. And like, I have not gotten a period in 3 years. I cannot, like, I'm medically shut down. And I kept just saying that over and over again because I'm like, maybe she just isn't understanding what I'm saying to her, but there's no other way for me to explain this. So I'm like, but it can be wrong, right? Like, there's a chance it's not actually positive. It could be a false positive. And she's like, "Yeah, but, they're pretty accurate." And I'm like, "Okay, well, phlebotomy's downstairs. Can we do a blood test, like, now?" She's like, "Yeah." She goes, "We'll do a serum test." She's like, "But I might have to poke you twice if, we do wind up putting the IV in." I'm like, I don't care. We have a bigger issue to figure out right now. Like, who cares? They've been poked a million times in 4 years. Like, let's just do this. So she does. And I'm like, how long is this going to take? Like, my boyfriend's sitting out in the waiting room. Like, he's going to start to get nervous if you guys don't bring him back here. She goes, "Well, I can go grab him." I'm like, no, absolutely not. We need to figure out what's going on before you bring him in here, because honestly, I don't know how he's going to react. And not in a bad way, but in a way of disbelief, because it can happen again. So now all these nurses are coming, and I'm sobbing. They bring me over a box of tissues. There's snotty tissues all over my hospital bed. I like close the curtain. I'm like, I don't want to see anyone. I was a mess. I didn't have my cell phone with me, so it's not even like I could distract myself. I was just sitting there thinking. Not only have I basically been told you will never have kids, not an option, and that's how I just lived my life. Now, I find out I'm pregnant. And realizing I've had years of poison and meds and radiation and all of these things pumped into my body. There's no way a baby will survive with everything that I've been exposed to. So not only did I go from not being able to have kids to being pregnant to now possibly not having a viable pregnancy and now having to terminate, mentally I was not in a good place. 2 hours go by and we finally, now, and again, nurses are coming back and forth. We had the charge nurse, another anesthesiologist came over, and everyone's like, oh, it's okay. They're trying to be comforting, and, this is a good thing. I'm like, wait, you guys are being very sweet, but this is not supposed to be happening to me. So finally, 2 hours later, the nurse comes back, and I look at her, and I know, and she tells me I'm pregnant. And again, I'm just sobbing, and she hugs me, and I feel bad because everyone's so wonderful, and I'm acting like a little brat, but I didn't know what else to do. So the anesthesiologist comes over. No, not yet. So now she asks me, do you want me to bring your boyfriend back? I'm like, well, yeah, he's got to come back sometime, right? Like, I have to tell him at some point. So she asks, what is his name? And I'm like, it's Eric. He's, just sitting out there. And so she brings him back. And I'm just, my face is, when I cry, my face gets really red and blotchy. Like, you can tell. I don't hide it well. And he walks back, and he can just see something's wrong. And I'm like, how am I gonna tell him this? And it's awful, because I wish I would have reacted a little bit differently. But when he walked back, and I was barely able to talk, and I said, they can't do the procedures. And he's like, well, what do you mean? Like, he sat there for 2 hours. He's like, why? Like, so now he's thinking, did something come back? Like, did something come up in blood work? Like, is something more serious happening? And the only thing that I could get out of my mouth was, I looked at him, and I said, I'm fucking pregnant. And I just sobbed. And he just grabbed me and held me, and we just sat there. So then he takes a very exaggerated deep breath and sits in the chair. And I'm like, I don't even know what to say to you. I don't know how to react. I don't know how I should be feeling. I don't know what to say to you. I don't know what you're thinking. I don't know if I want to know what you're thinking. It's too much. It's all just way too much. So obviously, I have to talk to a couple doctors now. So the anesthesiologist comes over, and we have a nice conversation. And then he says, well, the whole breast oncology team is at a national conference. There is no one here for you to talk to. Now, this is Friday. So now we have to go the rest of Friday, because it's still 10 o'clock in the morning. So we have to go Friday, Saturday, Sunday, hopefully Monday, to try to see someone. Not a good thing. So we get there, or he tells me, I can bring a nurse practitioner up from the breast clinic, and you can just talk to her real quick. And I'm like, okay, we'll talk to someone, right? Like, I don't know what else to do. So now she comes over, super sweet. I get all dressed, ready to go. And, she didn't really have much to say. Just, obviously you weren't expecting this. Your oncologist is in here. So Monday morning, we'll have you come in first thing, like come in at 8 o'clock. I'll just tell him that you're going to pop in, and, we'll try to sort things out from there. So we leave, and I told Eric after the test was done, I wanted tacos. That was going to be my reward for having to go through this, which tacos and margaritas are probably not the best thing to have after a colonoscopy, but that was going to be my reward. So one of our favorite restaurants in Buffalo, which is like right by the hospital, opened at 11. So we drove around for a little bit, and he's like, do you want to go? I'm like, yeah, I'm obviously starving. I need to eat something. And then he's like, no, I can't go anywhere. I'm like, no, that's fine. I'll just eat something at home or whatever. And that was it. I mean, we just sat there, and neither one of us knew what to say. I mean, he kept asking me, like, what are you thinking? What are you thinking? And I'm like, I have no idea what I'm thinking. Like, how can this happen? I didn't even get a period. Like, this never should have happened. So now his immediate reaction is, something's going to happen to me. I'm literally going to die because of this, for one reason or another. And, you know, I keep trying to tell him, well, we just have to wait until Monday. We have to talk to the doctors Monday. And he was just so on the other side of, like, you can't put this, you know, maybe you've only been pregnant for 2 days. He's like, you can't put that in front of, you know, your health and the rest of, you know, your treatment and whatever else. And I'm like, it was just too much. I'm like, I don't want to have to think about all this right now. Like, this morning was enough. Like, enough. We'll wait till Monday. And we just cried all weekend. And then we're like, do we tell anyone? Do we call our moms? Like, do we say anything? And I'm like, we can't. And it was no different than when I was diagnosed. I can't tell anybody anything until we know what's going on, good, bad, or indifferent. Like, I can't get everyone excited that I'm pregnant and then 3 days later say it's not a viable pregnancy and we have to terminate. Like, no one needs to be put through that. It'll be bad enough that we have to go through it. And really, for the first couple days, the first week, that's how we thought this was going to go. It wasn't going to be a successful pregnancy. There was no way. I had had more drugs put into me in this time frame. There's no way that this, like, the baby would have birth defects or, you know, some chronic weird disease, or the baby would have cancer, or it was just too much. So Monday morning, we get through the weekend barely, trying to keep ourselves busy, going to lunch with friends, going to the mall, you know, trying to, like, put on this front like everything's fine, which we did. I don't know how, because I'm not a good liar. You can see it all on my face. And I kept telling Eric, you have to talk to someone. Like, I don't care if you call any one of your friends, because you need to talk to someone. Whatever you need to do. I can figure this out. I've had to mentally figure things out like this for myself on my own for years now. Like, if you need to talk to someone who has kids, our very good friend, do that. If you want to talk to your best friend who has no kids, that's fine too. Just whatever you need to do to keep yourself sane at the moment. So Monday morning, we go to the oncologist, and the dogs are going to make a visit. They just breached the perimeter. Beefy will be first. Here he comes. Hi, puppies. You gonna say hi? You gonna say hi? Oh, you can't sit up here. All right, just sit. So Monday morning comes around, and, you know, so now I'm telling people, I called work. I'm like, look, it's nothing bad. Something unexpected came up on my, the procedure that I had this week, because they all knew that I was there because I wasn't going to be at work. I said, so I have to go see a couple doctors Monday morning, but I'll be in after. And obviously they were super good about it. They're like, no problem. Just, you know, hope everything's okay. So we go to see my oncologist first, and, you know, he basically tells us, even though I'm high risk, even though I'm supposed to be on this treatment for 10 years, you know, he assures us that there is decades of imperial data showing that me going off treatment for about a year will not increase my recurrence risk, which I'm fine with. He's very straight to the point. If he felt that I needed to be on it, he would tell me. I mean, 100%, that's why I love him. Eric can now not comprehend this. So I'm asking, and I told him before we left, not that he'd be a jerk, but I said, you need to be nice to him, because he might tell you something you don't want to hear, and I need this man. Like, he is keeping me alive. I need you to be nice to him. Again, I just don't know how he's going to react to these things. So he says, you know, well then, if her not being on this treatment isn't going to, you know, increase her recurrence risk, why are we doing this in the first place? And he's like, it doesn't make any sense. women have gone off treatment to try to start families all the time, and it's no like, higher risk for them. So now I'm content with that. So we leave, very quiet ride. Now I have an appointment with my OB like half hour later. Like, it was perfect timing. So I go in there, and my OB is actually the one that I went to when I first felt the lump. So he knows my whole history. He actually is positive for the BRCA gene, which is crazy. And he has also had cancer before, so like, he's just wonderful. And he remembers everything that I've gone through, and still remembers the day that I came in, and he's wonderful. So we go in there, and he, does the exam, and he says, clinically, I think you're 5.5, 6 weeks along. Oh, back up to oncologist real quick. His like ending statement was, he would continue to see me every 3 months, like normal. If something cancer related came up, then I would go see him. If not, I would just go see, the OB from that point on. But he said, you need to be considered high risk just because of everything that you've gone through. He says, I feel that there's more risk to the fetus than you, just again, because of everything I've had put into me and the treatments. So I tell this to my OB, and he says, you're about 5.5, 6 weeks along. So you are in the safe zone. So if you've taken anything, if you've had any medications, any form of chemo, like, nothing should really affect, the baby. He said, everything seems fine. He's like, but I will keep you. And he wanted me to go for a sonogram right after that appointment. And they didn't really have an appointment for me. So he's like, you're just, again, going to have to sit there just like when I found out I had breast cancer, which we did. But he also said, he's actually personal friends with the chief of maternal and prenatal medicine at Children's. So he's like the high risk doctor. He says, I want you to go see him, and then, he'll kind of determine whether we're going to keep you as high risk, or if you're not, or, he'll help us through this path as well. So I said, okay. So we leave, we go for the sonogram, and the woman, Eric, of course, was like, he had no idea what was going on. He didn't realize it was a transvaginal ultrasound, and of course he had to make jokes about it, which is what he does, which I love. But the woman, we saw the sonogram, and the baby looked like nothing. It was just like a little yolk sac. So it was like, even then, just not even sinking in, because it didn't look like anything. So we are getting ready to leave, and I'm like, well, can I have like a picture? Just saying, I don't know when the next sonogram's going to be, like, and she had said, like, everything was where it was supposed to be. Something about a corpus luteum, which I want to say was like a cyst or something that was supposed to be there, was a good thing. But she's like, everything looks perfect. So I'm like, all right, this is a good thing. And then she couldn't get the machine to print out a picture. The thing kept jamming. She tried over and over and over again. So now in Eric's mind, he's thinking, this is how everything is going to go after this. Like, this isn't supposed to be happening, and now she can't print a picture. And it was just funny. But anyways, the first couple weeks were not good. They were not easy. It took us a really long time to wrap our heads around it. Everything was fine, but we felt like something wasn't going to be fine, because that's just how things go for me. It's just what it's been for the last 4 years. So we were so nervous that, we were, and Eric's biggest concern was we were going to keep going and everything was fine now, but he's like, how do they know? How do they know in 3 months, when we're now super attached and embracing the fact that we're now having a baby, something crazy happens? He's like, it's just going to be harder. And, it was really stressful for the first couple weeks. You know, it was not good. I mean, it literally was like I was diagnosed all over again. It was just so many emotions. But here I sit, 21 weeks pregnant, and everything's been perfect. Like, everything is perfect. He moves like crazy. He's, you know, we went to Children's and they did the nuchal scan for, you know, Down syndrome markers and, you know, the blood test for that. And everything is exactly the way it's supposed to be. So even with my OB, the first time I saw him, he's like, you know, when did you get your last period? And I said, I haven't had one. I've been in menopause for 3 years. And he's like, you don't even understand how much of a miracle this is. Like, you didn't even get a period. He's like, have you had any symptoms? I said, I haven't, but, you know, I got sick a couple days ago, but I think that was just from the prep from the colonoscopy. I said, but also, like a few weeks ago, which totally makes sense now, when I was driving, and it was only when I was like sitting in the upright position, I was getting over a cold, and in my very lower abdomen, more so on my right side, like where your ovaries would be, I would cough and I would get this sharp pain there. And that must have been the egg implanting, which now it all makes sense. But I just thought, because I didn't have treatment for a couple months, my period was coming back with a vengeance and it was just going to be horrendous. That's clearly not what was happening. But he told me, you know, this is an absolute miracle that this is happening. Like, there's no reason that this should have happened. Like, medically, it doesn't make sense. And yet here we are. So we're super excited. I will do videos of first trimester recap, second trimester, just to kind of fill you in on how I have been feeling. Right now, again, I'm 21 weeks and I feel literally the best I have felt, minus like a couple pregnancy like symptoms. I feel the best I have felt in 4 years. Like, being off of cancer treatment, I feel amazing. And I didn't ever think I'd be the person that liked being pregnant. I always thought I would hate it, and I love it. I love the way my body feels. I love my little bump. I don't love all the changes going through my body, because pregnancy is not super glamorous all the time. But it's been a wild experience, and we're so excited now. You know, we have little nicknames for the baby already, and this is finally our something good. So we're super excited. I will do, you know, many more videos on this, because it's a huge part of really why I started YouTube. I love these. This dog is too much. But anyways, he keeps trying to give me his paw. He likes when you hold his paw. So anyways, thank you for watching today. I hope you guys really like this story. If you have any comments, please leave them below. If you like the video, please give it a thumbs up. Please subscribe to my channel so you can continue to follow me along on this crazy ride, and set up the notifications bell so when I make new videos, you can see them as well. So thank you so much. Enjoy your weekend. Bye.